Functional abdominal pain is a very common presentation in pediatric practice, especially among school children and adolescents age group. And worldwide incidence varies between 10 to 25%. In certain communities, you get very high numbers. Basically, when it comes to the diagnosis, it's a real challenge. And because this symptom can be really problematic, sometimes it might cause disturbance in day-to-day lifestyle. As far as diagnosis is concerned, basically that there should be at least 3 episodes of recurrent significant abdominal pain over the 3 months period. And when it comes to the diagnosis, basically it's diagnosed by exclusion. And the challenge is basically the symptoms are very vague and sometimes it might mimic the organic disorders. So when it comes to the diagnosis, in addition to the abdominal pain, it can be associated with symptoms like vomiting, nausea, and sometimes pallor. It may be associated with non-specific symptoms like headache and the arthralgia and myalgia. It's always important to exclude the organic cause. But having said that, you should not over-investigate because that can cause stress in the parents as well as in patients. So that causes worsening of the problem. For the diagnosis, the basic investigation is important when a patient comes to you for the first time, such as ultrasound abdomen, maybe urine full report, maybe full blood count, to exclude the main organic causes that may mimic the similar symptoms. And to exclude what you call as a red flag signs. Red flag sign mean that you have to exclude the organic causes. Pallor, jaundice, failure to thrive, organomegaly. So if you can find the organic cause, your diagnosis is not functional abdominal pain, it should be something organic. And the basic pathophysiology is basically the interplay between the gut motility, sensitivity, and behavioral and psychological problems and environmental problems in the management of functional abdominal pain. So it is the cognitive behavioral therapy is the mainstay of treatment. All other pharmacological and non-pharmacological treatment are only supportive. The basic treatment should be targeted at pharmacological, it may be behavioral modification or psychosocial modification, and then dietary modification. So it has been postulated that certain food allergies can lead to this type of symptoms. So always the detailed history is important to make a diagnosis, especially from the parents, whether it is related to the specific problem. In that situation, it's advisable to avoid that type of foods. When you talk about the pharmacological management, basic things, you give the prokinetics, maybe antacid-like things. Sometimes it's something to do with the gut motility. So medications like lactulose might help. In addition, it has been demonstrated that the probiotics, especially the probiotic containing bifidobacter and then Lactobacillus, bifidobacillus has a role to play when it comes to the treatment.